my name is Dr. Sharon Moen, and I'm a general dentist in Bradford, Massachusetts. I'm here today to discuss the Age 1 dental program. We are an Age 1 provider office. What does that mean? What it means is that the American Academy of Pediatrics and the American Dental Association are both in agreement that things needed to change as far as the child's first dental visit. We used to see children at the age of 3. This was due to the fact that children usually were behaved well by that age, and also all the baby teeth were in. The new standard of care is for the child to be seen by their first birthday or within 6 months after the first tooth erupts. This is due to the fact that children by the age of 5 have been increasing in the amount of dental decay that they are getting. It is not unusual for us to see a child at the age of 3 already with many cavities. For this reason, our office is a firm endorser of the Age 1 provider program. Here is a real-life example of an Age 1 dental visit.
Okay, you ready, buddy?
So is he pretty good about letting you brush his teeth?
Yeah, he's getting better
Okay.
now. He likes to do it himself.
Okay, good.
Which is good.
Start the habit.
Yep. So he loves to do that himself.
But it's also good to have you work in his mouth because then they get used to people being in there.
Yeah.
We're going to lay him back and I'm going to take a quick look.
Just gonna be in her lap.
Yeah. Okay. And here we go.
Wow.
Oh, what a good boy.
Wow.
Excellent. Oh my gosh, he's such a good guy. Okay, so we're going to see if he can open big and we're going to count the teeth. Oh, he's getting a little molar and there's a little strip of tissue over it, which traps the food, so even though it might bleed a teeny bit, that's okay.
Oh, good.
So I'm going to check and see if he has any plaque on his teeth because he's letting me. And he barely has that molar. And as I said, he's probably doing a great job brushing because there is no plaque on his teeth. There's just a little bit of food in the groove. So this is a baby brush. It's a little easier for you to handle.
Okay.
I actually like the plain old brush too, but this is what you just want to do. You want to angle it a little bit to the gum tissue and a very small amount
That's
of
a little bit
toothpaste.
too much,
So you could
right.
even take out some because they swallow it. It's really hard to get him to rinse. Okay, open again. See, he's already enjoying the toothpaste. He really is. So we just want to get the tooth. Now, as I said, that molar, which is way back there. The good thing about the round brush is that, you know, sometimes they'll jam it back and make you gag.
Yeah.
You can't do it with this
Right,
because
right.
it's so big, and that's why it's baby safe. So what you can do at home is you can even put him on your lap to do this.
Yeah.
Maybe with your husband
I know. I was just
helping.
thinking that I would do it like
And
this.
he really looks fantastic. He's a little young for this, but once the molars come in and they touch, you can actually take a little floss and go between. Children's teeth should have spaces. It's really good. It's almost self-cleansing. But when the molars come in, they won't have a space, and that's when this little floss works well. The last thing we're going to do is we're going to put fluoride on. Okay? This will help. It doesn't have a bad taste. We're going to try to keep it on. I'm going to really go in that tooth because I don't know if you could see it at all, but there's literally a band of gum tissue that goes right over that tooth, and so that's what will hold the food. Of course, not every appointment will be this successful. Children will often cry and squirm while they are having their teeth examined. This is nothing to worry about. We are very well prepared for this. It is not an example of your child's behavior or an indication of your parenting skills. It is just how some children will behave during this appointment. The goal of the appointment is to get your children's teeth examined, to discuss preventative treatment, so that we can hopefully give your child a lifetime of good dental health. We welcome you to call our office with any questions you may have regarding this appointment and hope that you schedule your child for their first dental visit by their first birthday. Thank you.